Hello everybody, good afternoon. So, no problem, I will not take for a while, I will be just little presentation because all of wise men in front of me, so I will take a very little time. So I am very happy in here with all of the nice people I meet in my life. So this is the thank you for Invine Company Meeting LLC for connecting us. So I am a Jewel call, my nickname. So I am working 23 years in the Kumila Diabetic Hospital and Kumila Nursing College. So I am not actually a wise man, but I am trying to do something for the patient, not too many. So in these conferences, so my abstract and presentation about the regarding the sports injury management and prevention. This one, how can this one? So sports injury, it is the common things we know. Injury that most commonly occurs during sports or exercises. So common causes: accident, poor training practice, improper equipment, lack of conditioning, insufficient warm-up and stretching. We are forgetting this one before the sporting. Anyway, common sports injury we know everyone because all of the professional in front of me, all of the professor also beside of me. So dislocation, wrist, sprain, fracture, concussion, injury to the brain, joint displacement, soft tissue injury, overstretched ligament, and crack or broken bone. So injury diagnosis how? We just talk to the patient, observe, are there any skill observation, touch the patient, active movement, passive movement, and especially the skillful test, whatever you want for the depending your injury or ACL or PCL or meniscus or other things. So acute injury we know everybody. So this is the suddenly occurred in our body. So there are the three main causes. So collision with the opponents or obstacle, just obstruct with someone, being struck by an object, falling from a height or at a speed. So chronic injury is persistent in a long term. So this is the chronic injury are caused by the continuous stretch on a body part over a long time, caused by training too hard, not allowing time for recovery, poor footwear or others gear, and bad technique. Overuse injury occur due to repeated powerful muscle movement. So rise is the management after the injured. Rest, ice, compression, elevation. It is really needed. So we should to avoid no harm after the injured of the athletes, like a heat, alcohol, running, massage. Running means you have to keep it rest. So hard and soft tissue injury, we know hard tissue and soft tissue injury because of the professionals in front of me. So hard is the bone injuries, soft tissue injuries, muscles, skin, ligaments, tendon, cartilage. Soft tissue injury and open injury means that the skin has been broken, blood usually escaped. Open injury include cuts, gouges, blister and chafing. A close injury occurs beneath the skin, there is no external bleeding. Close injury included bruising, pulse, strain and sprain. So open injury, so cut requires immediate attention. If there is cuts, stop bleeding and allow the blood to clot. So gouges and avulsion where skin is scraped of the body need to be cleaned properly, carefully as well. So open injury blister are causes by the skin rubbing on other surface. Chafing is caused by ill-fitting clothing or material. So during your sport, we have to carefully check it. Close injury bruise occur when small blood vessels are damaged by an impact or sudden wrenching movement. So close injury, sprains occur when ligaments at joints get stretches and torn. Strained muscle result from muscles being suddenly and forcefully overstretched. So a dislocation occurs when a bone is pulled or twisted out of a place at a joint. So soft tissue injury, blister, sprain with a torn ligament, sprain with a stretched ligament, strained muscle, bruising, bad cut, dislocation. Heart tissue injury, fractures, the bones either cracks or breaks. So fracture lead to a bruising and swelling. Pain due to a nerve damage, the limbs or area of the body where the break is bones immobilization. If it is a bad fracture, the area will look obviously deformed. So concussion is a common cause of unconsciousness while playing sport. Common area, fainting, head injury, heart attack or stroke, asphyxia, shock as well. So DRABC management, we know all of professional dangers, response, airway, breathing and circulation. So dehydration. Before the exercises, it is needed dehydration. So when we exercise, especially in hot condition, the body loses water. So as a result of sweating. So if the performer does not rehydrated by drinking lots of water, they may be suffered from dehydration. So causes and treatment: blister, fracture, concussion, sprain, impact breaks bones, wrenching from steers ligaments, rubbing on the skin, brain injury by blow to the head. Is the management will be rise DRABC and go to the hospital, immobilize the limbs, go to the hospital, keep clean and do not brush it, the blister. So injury prevention, how you can injury prevention is very common. Training, competing at the appropriate venues is very important, and surfaces with adequate clothing, footwear and protective equipment. Correcting poor techniques or biomechanical alignment and abnormalities. So complete exercise program. Stage 1, definitely we have to warm up the athlete. Slow walking and calisthenics jog in a place, 5 to 10 minutes. Stretching up and up to down, 20 to 60 minutes. Active exercises like cycling, running, dancing or others. Treadmill exercises 5 to 10 minutes, or up down, slow walk, calisthenics, jog in a place 5 to 10 minutes, stretching down to up 5 to 10 minutes. So additional tips: drink enough water based on activities and temperature levels, educate the athletes on proper nutrition for performance. Supervise equipment maintenance, encourage athletes to speak with an athlete trainer, coach, physician if they are having any pain. So enforcing warm up and cool down routines, encouraging proper strength training routines, mandating pre-competition physical exams. So sports is a friendship, sports is our health, sports is education, sports is life, sports being the world together. Thank you very much for all of participants. And greetings from Bangladesh, and my hospital, Kumilla Diabetic Hospital, is a charitable organization, is a large hospital in the territory. Mostly we are offering the treatment, all of procedure, mostly free. So it is a charitable organization. Thank you very much. Have a nice evening.
Thank you, Dr. Rafiqul. I call Dr. Maria to felicitate Dr. Jewel.
Yes.
Hello.
Thank you. Thank you.
finally we came to the last speaker of the day, Dr. Maria Emilia. She is from Rosario School of Dentistry, Argentina. Over to you, ma'am.